Good evening, everybody, and welcome to RAMP, Real Access Motivates Progress, live weekly podcast. We are sorry we are a little bit late tonight. We had some technical issues. Tech works when it works. When it doesn't, it's a huge problem. But the show is worth it tonight because we have a great advocate and CEO with us tonight. We have Christine Gabois with us tonight from Carelink. Welcome, Christine, and welcome to the show.
Thanks so much, Tina. Happy to be here.
Why don't we get right into it tonight and tell us a little bit about you and what you do?
As you said, I'm the CEO of Carelink, which is a nonprofit provider of specialty healthcare services for older adults and people with disabilities.
That's awesome. Tell us some of the things that Carelink does. What do they offer for Rhode Island, and how can people access it?
Carelink's been around for almost 25 years now and was started as a collaborative of long-term care providers focused on care for older adults. And over the past couple of years, we've been expanding to try to also provide care for people with disabilities, adults with disabilities. And our services range from rehabilitative services, PT, OT, speech. We just added respiratory therapy, which is very significant post-COVID.
Yes.
And we also provide a range of services such as dental care, podiatry, audiology. And what we do is we deliver those services to people where they are. So we serve nursing homes across the state, we see patients, residents in assisted living, in group homes, anywhere where people live.
Oh, that's great. So there's not like a physical location for people to go into, you go to them.
We actually do have a couple of outpatient offices that are newer, and we created those specifically due to people requesting that, people that live at home in the community wanting to come into an office setting for something like a hearing test or a screening for fall risk or some physical therapy. So we actually can do that in the office if people, or we can do it in the home.
Where are those locations around Rhode Island? Are they pretty accessible?
Well, as I said, it's sort of a newer service, but we have an office in East Providence, our main office, where we have outpatient. And then we have some sites that are scattered across the state, mostly within other facilities. So the St. Clair community in Newport, we have a site there. We have sites within some of the adult day health programs, specifically the Cornerstone adult day health programs, so that when people are going there to spend their day in medically supervised day program, the family members can know that they can also get some of their medical services there, which, as you, I'm sure, are well aware, for busy caregivers, it's nice to have, to be able to have that sort of one-stop shop so that they don't have to run somebody to, for a hearing aid appointment or
That is an incredible thing, because I know, just driving people from here to there and getting them dressed and getting them ready and getting them there, that's a chore in itself. Never mind having to sit and wait for the long doctor's appointments and the doctor to have time for you. And, it turns into a huge fiasco. So going to where they are is just such a huge plus for this. How does somebody get involved with Carelink? Is it like doctor's office that requests it or authorizes it, or can anybody just, ask for it on their own?
So folks can go ahead and make a self-referral, but they would need a doctor's order to start therapy or to, well, some services don't need a doctor's order, right? So if someone needs hearing aids, we can have our audiologist see that patient without a doctor's order. But if someone needs physical therapy or speech therapy, then typically for insurance reimbursement purposes, a doctor's order is needed. But we can get that for the patient, so that's not a worry.
Right. So you're not like a primary care doctor where like you don't have a doctor on site where people could use you as a primary care to get all the other services they need. They'd actually have to have a primary care and you do the services.
Exactly, exactly. And one of the things that we started to do fairly recently, and I think this will perhaps be of interest to you because I know that you're such an advocate. I know you just came, excuse me, in from advocating for wheelchair accessibility at the beach, right?
Yes.
um, so, one of the big issues is accessibility into healthcare providers' offices. So, we started recently bringing services into patients in group homes who are have some accessibility issues, and that's sort of building upon the work that we've done for years with going into nursing homes and assisted livings, where folks sometimes just can't get safely transported from the facility.
Right.
So you can
Now, do
see
you
them
go
on
into
site.
private homes, like individual homes? Like, will you just go out to like my home? I live out by myself.
For some services, we can. So we started again recently developing an outpatient program that can go into people's homes. Um, Physical therapy, occupational therapy, speech therapy. I think especially occupational therapy is very important to be done in it, in the patient's home, because in the person's home, because as any of us that have ever had occupational therapy know, it's really about how you move around in your own home, right? How you are able to
Right.
utilize the tub, how you're able to utilize your kitchen. um, it, so it really is a great benefit to be able to have the occupational therapy in home.
Yeah. I know when I suffered my stroke, and I needed the speech and the OT, it was great that it was in my home because they helped me walk through or roll through, however you want to say it. I roll, through my home to my daily routine. So like, how do I get out of bed? How do I utilize the bathroom? Where do I sit for the most part for the day? Do I transfer out of my chair? So they were able to work with me on the things that were most needed for me. You know what I mean? Where I am, you know what I
Mhm.
mean? So that's such a great wonder, how you can do something like that and why more people don't do that.
So, great example, Tina. And just to clarify, I'm going to guess that because you had a serious event like that, a stroke, you said, that you were able to have skilled care through a visiting nurse service, and they were able to send
Yep,
those therapists out under the
yep,
skilled insurance benefit. Um, for many patients who don't have an acute event like that and don't have a hospitalization, they're not eligible for in-home visiting nurse type or visiting therapy services under their acute benefit. So the difference is that so we work with a number of wonderful home care providers. We're actually affiliated with Hope Health and with Kathleen Naughton, and those
yep,
agencies do that kind of skilled in-home care for an acute episode. The work that we do is much more of a restorative, ongoing kind of a treatment. So we have people who um, maybe are having some falls in the home, maybe haven't had to go to the hospital, thank goodness, with a broken hip, but they've
right.
fallen or they're unsteady in their home, and that those types of services aren't reimbursable under the acute benefit because there hasn't been a hospitalization. So we're able to go in and provide what would be regular outpatient services in the home. So
That's
the same
incredible because
services that
yeah, one thing that, bothered me is once the nurse services signed off, said, okay, you've reached a point where we're signing off, there'd be a couple of weeks where like you'd have a couple of weeks where it would rain or something like that, and you weren't able to do your therapy on your own or get out and about to keep it functioning, that I would have loved to have a way of calling them back and say, hey, can we review this or can we review that or can we make this go?
right.
So that's basically what you would do. So the people who would need
Yes.
longer treatment and like a redo
Mhm.
um, treatment, that's what you guys do.
Yes, absolutely. Because, certainly there are, a wealth of terrific, skilled visiting nurse agencies across the state, and that's not the work that we do. We do sort of where instead of you having to go to one of those. I know myself, I've had several bouts where I've had to go for physical therapy, and I have to get myself to an office, which is unfortunate. I'm able to drive myself there and walk in. But once I'm in the office, I'm in typically with, a very wide array of patients. Often, I like to joke with some of my colleagues. I'm typically in there with the lacrosse team from, the high school, and they've got some knee injury or something, and
Yeah.
it's not a specialty for older adults or for people with significant disabilities. It's really and in fact, as someone who is maybe a little older or has more disability, you sort of feel a little out of place, even,
Yeah. It's intimidating when
in
you see
some.
the young jock recovering and you end up having the appointment around the same time that they do because you're probably like on the same twice a week kind of schedule and you're watching him recover a lot faster than you. And yeah, I see that.
Yeah, yeah. And so, and again, I'm fortunate because I am very mobile, but even just, they're saying, hop on this table and then get on the floor and get on that ball and do this. And it, it's a different type of therapy. So our therapists really, we don't work with kids. We don't work with, younger adults. We only work with our all of our healthcare providers, therapists included, only work with older adults or people with disabilities, older, adults with disabilities.
So
So, so it is that
is it just
specialty.
adults? Yeah. Is it adults with disabilities or as long as you have a disability, you would work with them, or is there an age cut off?
We really only see adults, and to be honest with you, the adults with disabilities that we've seen um, tend to be, in 40s, 50s, folks that are having some more chronic, sort of debilitating um,
Right.
problems, versus, those younger folks that are, um, it's sort of newer and they're in that more acute stage and they're going to Spalding rehab and they're, getting
Right.
fitted for special wheelchairs and things like that. So we do a lot of work with wheelchairs, but it's much more, fixing them and maintaining them. As
Right.
opposed to the kinds of services that, and I don't have to tell you that a newly disabled person would really benefit from going to your Vanderbilts and your Spaldings, right?
Oh, absolutely. Yeah.
Yeah.
Now does health coverage, do you take like all health coverage or Medicaid or Medicare? How is it all paid for? Is this out of pocket or a specialty? How does that all work?
So sometimes there's a copay, just as if if you went in the community, you'd have a copay, but it really depends on insurance. And we bill Medicare, Medicaid, the Blue Crosses, the Uniteds, the neighborhoods, all of the insurers.
Yeah, even like the state insurance and stuff like that. So anybody, no matter what level you're on, could take care of
Mhm.
this.
Yeah,
Yeah.
yeah. There are some limits to outpatient therapy coverage under Medicaid, and we've actually had a number of conversations with Director Schaefer at Medicaid about that. So, and I know that you've been active in the advocacy work as well. So.
Yeah, it's so important. It's it's trying to get the best life you can, the services that you need and finding a way to pay for it all, especially like you said, when you're disabled, you're on SSDI, so you're very limited, or you're
Mm.
elderly and you're older, you're again limited because you're on Social Security. So it's like, the $15 or $40 a week copays are just so difficult. How can somebody offset something like that, or are they usually that high?
We do find that, that the copays can be a challenge. And we have, just the other day, I was talking with one of our therapists who said that one of her older adult ladies had approached her and said, I just don't feel like I can I can pay these copays. And so what the therapist did was worked with her on an exercise program that she could do on her own, and then, really try to minimize the visits that get billed, to try to minimize those copays. But it's a challenge.
Yeah. Hopefully someday that we can get rid of the copays and people can get the services that they need. That would be in my perfect world. So I know it would be in yours as well. But it's just so hard because you got to choose. Do I get the services that I need to make me better, or do I eat today? You know what I mean? And those shouldn't be calls that we should be making. You must see a lot of people in that predicament.
We do, but I think because we see a lot of Medicaid patients, a lot of patients with Medicaid, where of course there aren't any copays, so that is a big help. Um,
That's
it's
incredible.
just that yeah.
Yeah. Tell me about some other partnerships that you have and some other things that you have coming down the pipeline that I have seen on Facebook and stuff of partnerships with this one and that one. Tell us about some of the other services that you guys offer.
Well, we, as I think I mentioned earlier, we work closely with nursing homes to make sure that the residents in the nursing homes have access to dental care, which is a huge need. I don't have to tell you how important it is to have good oral care. And they're really, it's very difficult to get patients out to a dentist from a nursing home. They get, especially during COVID, it exacerbated that problem
Right.
significantly, where
Or get somebody
people
in a
just really,
wheelchair into a dentist office that is actually accessible. Unfortunately, that's a
yeah,
huge problem because you can't switch over into their chair.
absolutely.
The offices are very small, maneuvering around all of their equipment. So that is just a challenge in itself.
Yeah, that's a really good point. And then, as you can imagine, during COVID, with folks in the nursing homes pretty much having to be kept safe, and not have contact with people, that became even more of an issue. So our dentists and hygienists, they go out to the facility, and they bring all the equipment with them. So we have special mobile equipment, X-rays, and I don't know the names of the tooth polishing things and drills.
Right.
It's all, yeah, it's all mobile, and the professionals bring it in with them and set up a clinic on site in the facility, and then the residents just come downstairs usually, and have their full dental care. We can't do really complex procedures that would require an operatory. So, if somebody has like a really impacted tooth that needs to be removed, or needs some sort of extensive restoration, then we still do have to send them out, unfortunately. But our dentists and our hygienists can do all the basic cleaning and small fillings and minor extractions, right there in the
Yeah.
facility, so that the person
That's
is
awesome.
more
Now, do you
comfortable and more safe.
Yeah. Do you have partners that you work with if somebody needed to have something more extensive? Do you have certain ones that are accessible, or knowing the patient that you have that you can refer people out to? Or do they just have to like
So
call
that
around Rhode Island and hope for the best?
Well, it is a pretty significant challenge to get community providers to see these patients because most of the patients rely upon Medicaid for their dental coverage. Because even if patients have Medicare, Medicare doesn't cover dental. So,
Right,
so almost all these patients rely on Medicaid. The Medicaid reimbursement, as you know, we've talked about in a lot of the advocacy groups, the Medicaid reimbursement for dental has not changed in decades and is very much below what the dentists in the community need to be paid. Um,
right,
so it's very challenging to find dental access for these patients, especially where they're going to need some more complex care and they're going to need some extra time. And as you said, they may need a wheelchair accessibility. So it presents a challenge for the provider to accept such significantly less reimbursement for a patient that's really probably going to be more work for them, to be
right.
honest.
Now,
We
when you
do
go
have
into the
some
nursing, yeah,
partnerships.
just
I was
when
just
you
going to
go
say,
into
we
the
do have some partnerships with Wood River and Well
okay,
One, which are both federally qualified health centers. Um, so they have some additional reimbursement that they can tap into to care for these patients.
yeah, I have a well one right up my street. Uh, right at the top of my street, there's a well one, so that's good to know for me. When
Yeah.
you go into like the nursing homes, do the patients need to make an appointment, or is it just like an open clinic? Like you say, okay, today's Carelink Dental Day. Anybody who wants to have their teeth cleaned can come on down.
I wish it was that easy. We have to get doctor's orders and medication histories and patients' medical histories. We have to work with the attending physician and the nursing staff at the facility to see which, to
Right,
establish a plan of care for the patients. And then we have to do all of the sort of the same paperwork you do when you go to your dentist. We have to make sure we have all the consents and releases, and then we
right,
have to make sure that we have the insurance. So we have to know, do they have insurance? Does it cover any dental care? If it doesn't, we have to try to track down family members to say, would you like your mom to have dental care? Are you willing to pay the copays? Um,
right.
so all of that has to be done ahead of time. So we actually have a wonderful office manager who works with a team to do all of that scheduling. And
That's incredible. That's a lot of work to do, but getting the basic care to that population is really huge.
yeah, so typically when we go to a nursing home, we will let them know, ahead of time we're going to see these 6 patients, and we actually don't give people appointment times because we'll say we're going to be at the facility Tuesday morning at 9 a.m. We're going to see these 6 patients, and we leave it up to the nursing staff and to the patients to decide who's up and ready early, who's
Right.
not wanting to get ready quite so early and wants to have their breakfast, and or who's busy at bingo. um, and so we do let the nursing staff and the patients sort of decide their own schedule.
That's awesome. I remember when my grandmother was in the nursing home, they had something like this come up where they were going to check her teeth. So she just took them out of her mouth and she goes, "Here, give them those. I'm staying upstairs watching Jeopardy." So I'm like, I don't think it really works like that, ma'am, but nice try. She just wanted to send her teeth out. I'm like, yeah, I don't think it works that way.
That was a good
So what
try.
are the
Yeah.
other partnerships other than dental? What are some of the other partnerships that you have or services that you have?
So, as I think I mentioned in the beginning, Carelink was started 24 years ago as a collaboration of long-term care and subacute providers. So, we have we're a membership organization also. In addition to all the provider work that we do, we also sort of coordinate some services amongst our members, which include the St. Elizabeth communities, St. Clair of Newport, Tockwatton on the waterfront, Steer House Nursing and Rehab Center, the Scandinavian communities, St. Antoine and the Villa up in northern Rhode Island, the Seasons in East Greenwich, Hope Health, and which includes Hope Visiting Nurses and Hope Hospice,
Yep.
um, Kathleen
You're
Naughton
busy.
Home Care, and the Cornerstone Adult Day Health. Yeah.
Uh-uh.
So we work with all of those partners to coordinate care across that continuum. So to help um, make sure that patients can move seamlessly amongst between the levels of care.
That's incredible. Do you work with any kind of like mental disabilities or Alzheimer's or any of that? Do you work with those kind of patients as well?
That's a great question. So, as I said earlier, our clinicians only work with adults with disabilities and older adults, and are actually specially trained to work with folks with Alzheimer's and related dementias, also Parkinson's. We have a number of really innovative, evidence-based Parkinson's therapies that we do. Trying to think of some of the others, specialties. You asked about mental health. We started just recently in response to needs in the nursing homes and in the group homes to start to provide some consultative psychiatry. Still a very small pilot program. So really our specialty lies more with, as you said, the Alzheimer's and other dementias, Parkinson's and other brain
Yeah,
injury.
that's such a great, because like I said, taking them out, meeting them where they are, because taking them out, could be devastating thing to them, changing their schedule or changing their movement of what they have to do could really badly reflect on what they go through during the day. I heard a little rumor, I don't know if it's true, so you can confirm or deny. Have you guys partnered with Parkinson Place? I think
Oh,
it was
so
the,
that is indeed a good rumor. We have been talking with Rich Gingras.
yep,
Um, I think I'm saying the right name, right?
yep,
Um, about partnering to try to build upon the amazing work that he's doing with the boxing gym. Um, and he's quite an amazing guy. I got to meet him a couple weeks ago, and he has really developed such a comprehensive program for the folks that are participating at his gym program. It's really pretty
yeah. Can you
amazing.
can you speak a little bit about what his program does for the people who aren't familiar with that? It is an amazing program.
So it's built upon there's a very significant evidence-based therapy that's a boxing therapy for Parkinson's. There's a national group that does, and I'm forgetting the name of them, uh, that does this boxing therapy. And he was affiliated with that group, but then he sort of took it to the next level. And so he does these boxing therapy exercises with the patients, but also has just taken it upon himself to add a level of support groups and sort of individual and group sort of support therapies to the folks that are participating at the boxing gym. It really is amazing. And so
Yeah,
he's asked us.
yeah. Yeah, he's done
Oh, I was just
amazing
gonna say,
work,
because
and
he's asked us to bring in physical therapy and occupational therapy, to bring in those professional therapies that there's LSVT, which is specialized therapy for Parkinson's, which a number of our clinicians are trained in that. Um, and he wants to integrate that into the work that he's doing.
that's amazing. Because I said he has put together such a wonderful program. And when I heard from him that he was partnering with you, I'm like, well, you and Christine are just going to be a powerhouse together. So that's just going to be amazing for Rhode Island. So when I heard that news, I'm like, I need confirmation when I talk to her tonight that that's actually happened, because that would be so cool for Rhode Island and everybody that's suffering. Bringing you guys together, like I said, what powerhouses in Rhode Island to take care of such a vulnerable population. It's amazing and it's such needed. And that's what it's all about. None of us can do what we do or the specialties that we do without each other. We're Rhode Island. Everybody knows a guy. We are, as my shirt says, we are stronger together. We need to work together and we need to find common ground where we can help each other out. Because I may have a client that would be great with you, and you may have a client that Rich could work with, and vice versa. Bringing all of these unique organizations together, working for a common goal, we're going to hit that goal a lot faster. Give us a little bit of what your thoughts are on that.
I really couldn't agree more. It's all about collaboration. We are so fortunate in Rhode Island to be a small group and well connected. I was
Yeah.
just thinking about another really important group that we've been working with for probably almost 2 years now. It was pre-pandemic. I don't know if you know Denise Lowell, who runs Just Ask Aphasia.
Yes.
Yeah.
Actually, when I took my
So
stroke
she,
on Mother's Day, I took her classes to help get my speech back. So yeah, she does a
oh,
wonderful. Yeah, because
she
I
does.
had
And
the stroke
so,
in 2019. I took a double stroke and really lost my voice and did all of the speech classes, but I needed just the touch up because it wasn't as bad. So I took a couple of her classes and I got it right back. So she's the thank for me speaking now.
so it's funny I brought her up then. So Denise, she does all of that work on her own, just as a volunteer, and the like Rich, the work that she's done is just amazing. The therapies that she's brought from across the country and brought to Rhode Island, and just done it all, as a volunteer. So we had spoke. Denise and I worked together many years ago, and we spoke a couple of years ago when I first got to Carelink, and she shared with me the amazing work she was doing with Just Ask Aphasia. And so we've been doing a little bit to help support her efforts. We have one of our speech and language pathologists, our speech therapist, who has been attending those groups every week, um, just to support the group. So we just do that as a community service. There's no reimbursement for it, but we just know how critical it is, the work she's doing. So
Yeah.
so we've been sending a speech therapist every week to work with her. So you
That
may
that
have
is
you have maybe.
incredible. May have met her, yeah. I mean, that, like I said,
Yeah.
it's just incredible, but look at all of the people who are doing this incredible work on their own and bringing them together and partnering with them and partnering with other people to spread their knowledge and their expertise in that field just helps more people. Like,
Mhm.
the one thing that bothers me is everybody who wants the credit for everything. Who cares who gets the credit? As long as we're helping people and people are getting the services, I don't care who gets the credit. I just want it done. You
Mhm.
know what I mean? I just want to help as many people as possible. And that's the whole point of my show, is to highlight amazing people like this, amazing people like you, and all of the stuff that we do good here to help more people. Because there's so many resources out there that people just don't know about. And that's sad because the help is there. They just need to be connected with it. So part of the whole point of bringing this show alive was to highlight the amazing resources of people like you out to the community so people know what's out there so they can go and get the help.
Well, thank you so much for giving me the opportunity. Carelink is a small nonprofit. We are always looking to partner with folks because, as you said, you definitely can do more together.
Right. What is the one thing that you would like to leave our Rhode Islanders who are listening tonight to know about CareLink? Like the biggest thing that would bring them in to know about CareLink. Why should they call you?
I think I would just emphasize that we make sure that we are the experts in older adults and people with disabilities. We make sure that we are on top of the latest interventions that will benefit those folks.
And how can they get in touch with you?
So our website is in pretty good shape and has a lot of information on it. We did update that recently, and then our main office number. I'm
Oh,
looking
wait a
it
minute.
up because I can never
Give us out
remember.
the website.
So our website is www.carelinkrI.org.
Okay.
And then our main phone number is 401 490 7610.
So make sure you guys are all checking it out and checking on the services. Now, people could call up just to find out if you guys take their insurance, or like for a free consultation to see if it would be right for them or for their loved ones. Now, not just the patient can call, but the family can call as well to and correct me if I'm wrong, to get the information for their families. What do you get more of, the families calling or the patient calling?
Because we work predominantly in long-term care settings, we very often are talking to family members or to other paid caregivers. So, the nursing staff are frequently, calling to say, Mrs. Smith needs, you know, she's got tooth
Whatever,
pain
right?
or she, yeah.
Yeah. That is awesome, but we can't thank you enough for what you do. But um, getting near to the end of the hour, I want you to give us one thing that you want everybody to know.
Just that we're here to help.
That is awesome. And we're going to be sending you some of our ramp red bags. It's carrying all of your medical information on you at all times. So we're going to be sending those to you so you can give them out to some of your patients and get that
Oh.
initiative working through your organization. That's what ramp wants to do for you. But I can't thank you enough. Your website is www.carelinkri.com or
.org,
.org.
nonprofit.
.org.
Yep.
So it's carelinkrI.org. I knew whatever one I chose it was going to be the wrong ones. But make sure you are contacting Christine to get all of your services where the patient lives, where they're at. It's so much easier for the elderly and for accessibility. That is a huge issue. So make sure that you're contacting CareLink and Christine. And thank you so much for being a guest and sharing everything that you do. We can't thank you enough for being an amazing advocate. And Ramp wants to work with you guys so you guys can send people our way if they need some help or a little kick in the pants. We can do that too to make sure that the businesses become accessible. But thank you very much.
Absolutely.
And I'm
You
so
send
glad
over
to have
that
you.
info and we'll send over your
We'll make
info.
that
We'll
happen.
include it. Yeah.
Oh,
Thank you so
perfect. Thank you
much.
so much. And I want to invite everybody back next Wednesday. We will be talking to Rhode Island elder info with Deb Burton and learning about everything she does, and she does everything that we do, and we all work together. So we're one big happy family here in Rhode Island. So join us next Wednesday, and thank you again, Christine, for joining. And everybody call www.carelinkri.org. You will not be disappointed to work with this fabulous advocate that we have here in Rhode Island. Make sure you're using it. Have a great night. Don't just sit there, make a difference.